Hello and welcome to today's episode of the Langford Academy. We're talking about laryngeal paralysis, and this is the third part of the video where we'll talk about post-operative management and sort of long-term management of cases that have had a laryngeal tieback. If you are able to, I'd probably suggest watching parts 1 and 2 first, just to follow through this case that we've been discussing, Duke, a Labradoodle, which has got laryngeal paralysis and gone through surgery. If you are finding the recordings useful, then please do like and subscribe to the video. You'll be the first to know about updates, and it really does help our channel to grow. So the summary so far is that Duke is an older Labradoodle that's been diagnosed with laryngeal paralysis. He's also got a polyneuropathy, and he's undergone a left-sided cricoretinoid lateralisation, so a tieback procedure. During the recovery period, these animals are at quite a high risk of aspiration pneumonia, so we need the recovery to be as slow and as calm as possible. We don't want the animals getting overexcited, because then there's a risk of them breaking the sutures that we've placed to try and hold the larynx open. We also ideally probably want to avoid post-operative opioids. So there was a paper from Monet's group looking at this and suggesting that animals that were given post-operative opioids were more likely to aspirate. I think it's obviously a retrospective paper, so we don't know how true that is, but I think equally these animals are not often that painful. It's quite a small surgical approach. We've hopefully not done too much disruption within the neck, and so I think certainly for us we don't usually find we need post-operative opioids, so we do try and avoid them where possible. Because we've cut through the animal's thyropharyngeus muscle, their swallowing is likely to be effective in that immediate post-operative period. And also these animals often have a concurrent polyneuropathy, which means they're a little bit more likely to have difficulty swallowing anyway. So we need to be really, really careful that we don't feed these animals too early, because what we don't want to do is have all that food and water going straight down into the airways and causing a really severe aspiration pneumonia. So for me, we need to wait till the animal is fully awake before offering water. So they should be up and about, walking normally, breathing normally. And if they seem really conscious at that point, we'll offer them just a little bit of water to start with. If they're drinking that water okay and they're not gagging or choking on it, at that point we'll then start to hand feed small bits of food. So for us, we'll use a tinned complete dog food. We'll form it into small sort of meatball-sized chunks and then hand feed them initially. So we want to make sure that they're swallowing completely normally. So we'll hand feed one, as long as they swallow that okay, we'll then try another and so on. But certainly for that first sort of 24, 48 hours, we'd much rather hand feed the animals and be in control of that process if that's possible. Usually we'll then try and get them out of the hospital relatively quickly, so either the same day as surgery if they're waking up really, really nicely, or if not the following day, because what we do find in these dogs that have had a tieback is keeping them calm is probably one of the most important things. And I think often animals will be calmer at home with their owners, and so if they're safe to get home, then we'd try and get them home with their owners into their home environment, as long as the owner's going to be around to care for them and so on. We do need to keep them really calm, and that's probably for at least 4 to 6 weeks after surgery, because that's the period of time which will take for the larynx to sort of fibrose in that tied open position. So during the first 4 to 6 weeks, we are at risk of those sutures breaking. So if the animals do get overexcited, they're breathing harder than they should be, or particularly if they're trying to bark, then those sutures could break. And then actually, because we've destabilised the larynx during surgery, we find that they're actually worse with a broken suture after a tieback than they were before surgery. And they could obstruct really quickly and need to have an emergency operation to try and rectify that. So we do want the animals to be as calm as possible. We'll discharge them with some oral sedatives if needed, or anxiolytics, so something like trazodone. We'll also tell the owners to avoid any triggers. So for example, a dog that barks every time the doorbell goes off, we'd usually say either to keep the animal away from the doorbell, or if necessary actually just disconnect the doorbell to stop it causing that noise that makes the animal bark. We want to avoid neck leads for these dogs for life, so nothing around the neck, no collars, no slip leads, nothing like that. Just walk them on a harness or a halty. Initially, again, for that first sort of 4 to 6 week period, we want to have them on soft food. And some people get a bit nervous about these dogs going swimming, and this is obviously later down the line once you've gradually built up their exercise. But if you have potentially over-abducted that larynx and that the epiglottis can't cover the glottis, then they could be at risk of aspiration of water during swimming. So we do need to be a little bit careful. Other complications to look out for is wound complications, so things like seromas and infections. For us, and this will go with most of the surgeries we do, if we do suspect a seroma, so a sort of fluctuant, non-painful, fluidy swelling after surgery, we wouldn't usually aspirate that to check it's a seroma because that can introduce infection. It can cause leakage of it, which then can allow ascending infection into the seroma. So just leave it well alone. Try and rest the animal more if you can, but that seroma should get better over a period of days. If it is really, over a period of weeks, if it is really pressing on the larynx, there's a bit of pressure in there, then you may find you need to drain it just to help with the breathing. But as I say, that would be a sort of last resort rather than something that we do early on. Infection should be more obvious because you're likely to have some discharge from the wound or wound breakdown. The surgical site will feel a bit more hot or painful, and then in that case, if we're fairly suspicious of infection, we could start some antibiotics to try and help with that. Suture breakage we've already discussed, and so again, if you do suspect that's happened, so there's been a sudden deterioration in the breathing, they've got that inspiratory stridor again, then at that point we'd have to consider doing further surgery. And if we are suspicious of aspiration pneumonia, so that sort of coughing or crackly breathing, again, those animals might need some oxygen support and some antibiotics to try and get on top of that. We mentioned already with the suture breakage that they could be worse than they were before surgery, and therefore you are likely to have to reoperate. You might be able to repeat the surgery on the same side but use a different technique, so something like the thyroarytenoid lateralization. So I've put the picture of the larynx up again here. So what you do in this situation is put some sutures from behind the arytenoid, so open up the larynx, place the sutures from medially through the arytenoid cartilage, so you'll need a double-armed proline suture. Place both needles through the arytenoid and then through the thyroid, and then tie them on the outside, and that will cause the arytenoid to pull laterally, so it will abduct the arytenoid and also pull it slightly dorsally, and that should open it up enough for them to breathe. Or if you're more concerned, what we'll actually more commonly do is to repeat the procedure on the right hand side. So rather than going back in on the left side where there's lots of fibrous tissue, things are a bit disrupted, we'd start again on the right hand side. The difficulty of doing it on the right hand side for people who are familiar with this technique is everything's backwards, and for most right-handed surgeons like myself, you're then going to try and be passing the suture from caudally to cranial on the right side. You're having to do that backhanded, so it's just a little bit more difficult to do. But as I say, it's probably easier to do that rather than try and repeat the surgery on the left side. And we mentioned aspiration pneumonia, so we know that if these dogs have megaesophagus on that pre-operative x-ray, the conscious x-ray, then aspiration pneumonia is going to be much more likely post-operatively. But even if they don't have that, we're still going to see around sort of 8 to 21% of these dogs will aspirate at some point following a tie-back. So that's actually quite common. So owners do need to be on top of that. They need to be monitoring these dogs closely. If they're having difficulty breathing, particularly on expiration, the breathing rate is more rapid, particularly if they're pyrexic, there's other things going on, then always be really suspicious of aspiration pneumonia in a dog that's had a tie-back. And we often find that can deteriorate quite quickly, so it is quite important to go and see a vet as soon as you can, and at that point they're likely to want to start some antibiotics and they may want to do some chest imaging, but obviously just be aware that we often don't see radiographic signs of aspiration pneumonia until around 24 to 48 hours after the aspiration event has happened, so you may not see any changes straight away on x-rays. So I think, again, if you are suspicious of it, you're hearing crackles on auscultation, you're suspicious from the animal's respiratory rate, for anything else that you see, then probably starting antibiotics early in those cases would be a sensible idea. And actually there are all these risks that we've talked about, but overall these animals do typically do really well. So over 90% of them will have an improvement in terms of their quality of life, their ability to exercise and just to breathe like a normal dog. And we know that around 70% of them will still be alive at 5 years after surgery, which actually is really impressive because a lot of these animals are a lot older that we're doing tiebacks on. So I think it's really important just to make sure you are choosing the right candidates for surgery, that we're not doing it unnecessarily because of all these risks that we've talked about. But for the right case, a tieback can really make a massive difference to the dog's quality of life and their long-term outcome. I hope you found these videos really useful. We're trying to turn out content fairly regularly on the Langford Academy channel. It is all free to watch at the moment, so please do come along and subscribe to our channel so you're the first to hear about the new videos. And if you are enjoying them, then as I say, keep tuned for the future things that we're going to be releasing. Thank you.